Anatomically speaking, the forearm is the part of the upper limb between the elbow and the wrist joints. It contains two bones, the ulna and the radius, which provide support to local muscles supplied by an intricate network of nerves and vessels. On the anterior part of the elbow, there's a triangular fat-filled pit called the cubital fossa, which is where the majority of important nerves and vessels to the forearm and hand can be found. Okay, before we start, it's important to know that even though some of the muscles of the forearm attach proximally to the humerus, they still belong to the forearm. The forearm is divided into two compartments, which are separated by the radius and the ulna, and the interosseous membrane running between them. We have the anterior compartment, which contains flexors and pronators. Next is the posterior compartment, housing the extensors and supinators of the forearm. Generally, muscles in the same compartment are innervated by the same nerve. So the muscles of the anterior compartment are generally innervated by the median nerve, with a few muscles being innervated by the ulnar nerve. Muscles of the posterior compartment, on the other hand, are innervated by the radial nerve. Now, the muscles of the anterior compartment are divided into three groups, or layers: superficial, intermediate, and deep. In the superficial layer, there are four muscles which all arise from a common tendon attached to the medial epicondyle of the humerus. So this attachment site is called the common flexor origin. Muscles attaching to the common flexor origin are the flexor carpi ulnaris, the palmaris longus, the flexor carpi radialis, and the pronator teres muscles. Now, let's look at these muscles one by one. On the most medial side lies the flexor carpi ulnaris. This muscle has two heads: the humeral head that proximally attaches to the medial epicondyle of the humerus, and the ulnar head proximally attaching to the olecranon and the posterior border of the ulna. As these two move distally to the wrist, they fuse into one tendon that crosses the wrist to distally attach to three bones: the pisiform, the hook of hamate, and fifth metacarpal bone. Although muscles of the superficial layer are primarily innervated by the median nerve, the flexor carpi ulnaris muscle is an exception because it is fully innervated by the ulnar nerve. This muscle mainly flexes and adducts the hand at the wrist joint. Lateral to the flexor carpi ulnaris, there is the palmaris longus muscle. This muscle proximally attaches to the medial epicondyle of the humerus and extends distally to form a tendon that attaches to the distal half of the flexor retinaculum and the apex of the palmar aponeurosis. The palmaris longus muscle is innervated by the median nerve. When it contracts, it flexes the hand at the wrist. A little fun fact about the palmaris longus: it is absent in about 14% of people, but luckily, its absence doesn't come with any functional deficits. Lateral to the palmaris longus, there's the flexor carpi radialis muscle, which also proximally attaches to the medial epicondyle of the humerus. It extends distally and laterally to the middle of the forearm, forming a tendon that attaches at the base of the second metacarpal bone. The flexor carpi radialis is innervated by the median nerve. When it contracts, it flexes and abducts the hand at the wrist joint. Finally, there's the pronator teres, which is the most lateral muscle of the superficial muscles in the anterior compartment. It also has a humeral and an ulnar head. Proximally, the humeral head attaches to the medial humeral epicondyle, while the ulnar head attaches to the coronoid process of the ulna. As the muscle extends distally, its two heads fuse into one tendon that attaches to the midshaft of the radius on its lateral aspect. The pronator teres is innervated by the median nerve, and its contraction pronates and flexes the forearm at the elbow. Okay, now what if we take a 1-minute pause to just flex your wrists? At the same time, try to remember the muscles that attach to the common flexor origin. Now let's have a look at the intermediate layer of the anterior compartment of the forearm. It's a one-muscle compartment containing only the flexor digitorum superficialis. This muscle has two heads, a humero-ulnar head that attaches to the common flexor origin and the coronoid process, and a radial head that attaches to the superior half of the anterior border of the radius, also called the anterior oblique line. Moving distally, the two heads of the flexor digitorum superficialis fuse together in the middle of the forearm, and that eventually splits into 4 separate tendons at the level of the wrist. All of these tendons pass deep to the flexor retinaculum in the carpal tunnel, eventually attaching to the shafts of the middle phalanges of the medial 4 digits. The flexor digitorum superficialis is innervated by the median nerve, and its actions depend on how hard it's contracting. When it contracts moderately, it flexes the middle phalanges at proximal interphalangeal joints of the medial 4 digits. With a stronger contraction, this muscle flexes the proximal phalanges at the metacarpal phalangeal joints. Finally, let's look at the 3 muscles of the deep layer of the anterior compartment of the forearm: the flexor digitorum profundus, the flexor pollicis longus, and the pronator quadratus. The flexor digitorum profundus has 2 proximal parts, a medial and a lateral part, and both of them attach to the proximal 3/4 of the anterior aspect of the ulna and the interosseous membrane. Distally, the medial part splits into 2 tendons to attach to the base of the 4th and 5th distal phalanges, and the lateral part splits into 2 tendons to attach to the bases of the 2nd and 3rd distal phalanges. All the tendons pass posterior to the flexor digitorum superficialis and flexor retinaculum. The medial part functions to flex the distal phalanges of digit 4 and 5 and the distal interphalangeal joints, while the lateral part does the same thing for the 2nd and 3rd digits. An important distinction here is that the lateral part is innervated by the anterior interosseous nerve, a branch of the median nerve, while the medial part is actually innervated by the ulnar nerve along with the flexor carpi ulnaris. To easily remember this, think of how the flexor carpi ulnaris and the medial part of the flexor digitorum profundus are both medial and are closer to the ulnar side of the forearm. This will remind you that they are innervated by the ulnar nerve as it travels more medially in the forearm as well.